Paula here, your musculoskeletal specialist with Brooke, and we're going to be going through some information on lower backs, some assessment strategies, and maybe a couple of treatment options that we can use in the clinic. We have at least 90% of our client base that come to see us with either lower back pain or neck pain, and Brooke gets lower back pain. Yeah. So she's working around it with doing Pilates and yoga and some stretches, and she actually has a physiotherapist and comes to see me every now and then. But what do you do when a client comes in and complains of lower back pain? So I get them to come into the clinic, I get the history taken, and then I just get them well, we're in this position, so I can chest check straight away what she's like. Is she sitting flex forward, or has she got a nice straight, stable back? I'm going to get you to just cross your hands over your chest so they're out of the road. Can you twist for me? And I'm going to look to see, can she move evenly through the thoracics, or is there one side that's a little bit tighter than the other? And I might get her to laterally flex. And again, what we're doing is we're assessing the quality of the movement. I'm looking at the spine. Oh, nice click. We're looking for the quality of the spine and any of the reproducing of the patient's symptoms. So now I'm going to get her to stand up for me, and we're going to do the same thing. So Brooke, can I get you to just side bend for me? What we're doing is I'm looking to see the quality of the movement and the other way. And I'm actually also checking to see, back up to normal, how thick her erector spinae muscles are or not. I'll get you just to slide down a little bit. You don't have to go too low. Is there any pain in that movement? We look for the quality. Is she tighter up through the here or tighter down in the hamstrings? So if I can come up again for you. People with tight lower back, they might be able to come all the way down, but there's very little back movement, or they might have tight hamstrings, which mean they will turn and curl like that. And then I get them up against the wall, facing the wall, and we just check to see. I'll bring one out to your chest, and I'm checking to see if her SIJ joints are moving. So this is a modified stalk. I've got a thumb on each below the posterior or PSISs to see if they are moving and if there's any pain or discomfort through that. Anything through that? No. Great. So then we're going to get our client to lie on their backs. So I'm going to get you around, and I'm going to put while we dance around the table, lying down on their back. Let's check to see if their leg lengths are normal, and she's got the normal amount of external rotation, which she does. Bend your knees for me, feet flat. Push your bottom up in the air a little for me. Is there any discomfort in that? We check for pain and down to see if there's discomfort, and then we slide those legs out and just check if there's any leg length anomalies. Secondarily, I'm going to check to see if she's got good range through her hip joints in a closed pack position and an open pack position and in a stretch position. And I'll do that on both legs. And we also, really importantly, check to see, has she got good rotation through the lumbar spine now? Because before we looked at the thoracic, and this one is where I'm going to be looking to see, is there quality through those ranges? Brooke, I'm going to get you live facing the camera for me. Both knees bent. And now I start to feel along on the sideline, her erector spinae. Does it feel tight and restricted through this area, through here? Has she got any tender points as I'm pressing along the lateral gluteal muscles? And is there any restrictions or stiffness through the superficial tissue of her iliotibial band? Now, the iliotibial band is a band that goes around the entire thigh, not just the lateral side. But we can feel a sense of whether there's tightness, and all the way down the lateral leg as well. So the whole lower limb, is that tight? If it's tight, it's telling me that there's some instability up in the trunk, which means there's got to be more restriction or fascial weaving to support on the lower area. I'm also going to check her neck to see if she's got any tenderness along the lateral joint. So just palpating down onto these joints, thumb over thumb or thumb over fingers, just to feel if there's a natural glide. And then we're going to get lying on your tummy. Thanks for us, Brooke. And I'm going to palpate. I'm just pressing down on each of the lumbar vertebrae to feel if there's some movement, nice glide in there. Or if she goes, that one's a little bit sore, this one's not. These three are sore, everything feels fine. So I'm assessing through there. And I'm then going to have a palpate on her sacrotuberous and iliolumbar ligaments. So we're going to go thumb over thumb onto the ligament, compress down onto the secondary or the lower sacrotuberous, both sides, and get a sense of whether they feel like there's movement that feels even and balanced. And then lastly, I'm going to come up and I'm going to look at her internal, or this is external rotation and internal rotation at the hip joint, because movement through the hip joint will give me information on whether her granularly and her obturators are really tight, or whether there's an imbalance between one or the other. And don't forget, a lot of your clients are going to have tight restricted quadriceps. It's going to tighten and tip the hip forward, and we have a lot of lower back problems from restricted quadriceps. So quadriceps have to be assessed in this range as well. We're going to get another video later on the techniques that we can use, but that's probably just a really nice simple overview of assessing just the quality of movement and some of the active and passive ranges that we can expect to see.